Hello everyone, a warm good afternoon to you all and welcome to EduTerrain. So today we are going to see yet another interesting scheme and which has been in news lately for many reasons, and that is Central Government Health Scheme. The name itself suggests it is the health scheme that is for the employees of the central government. Okay. Now, in what context this would be helpful? This would be helpful as part of your phase 1 under the government schemes for regular current affairs, as well as this would be helpful for your ESA current affairs as well. Again under the same section government schemes, but for phase 1 and phase 2 both. Okay. Now, these are my credentials. You can go through it later as well. Okay. Now, why this scheme? So the context behind this scheme is it has appeared in the news in the recent times. One, for the launching of the My cghs app for iOS devices. This has happened on Wednesday, 3rd April 2024. And this particular app has been launched by the Ministry of Health and Family Welfare, because the central government health scheme itself is under the purview of the Ministry of Health and Family Welfare. And the objective of this particular app launch is to aid enhancing the online health records, medical information and resources for beneficiaries of the central government health schemes. For that purpose, they have launched this app. And this particular scheme was also in news for another reason, and that is on date, that is March 28, 2024, in an office memorandum that has been released by the Department of Health and Family Welfare of the Ministry of Health and Family Welfare. What they have highlighted was they have sent a memorandum that the cghs beneficiary IDs should be linked with the Ayushman Bharat health account ID, and this they have made it mandatory with effect from 1st April 2024. See, when we talk about central government health scheme and its cghs beneficiary IDs, this would be applicable for all those who are working under the central government. Central government में कई सारे departments में कई सारे institutions है, कई सारे organizations है. For all that this would be applicable. अच्छा, including जैसे केंद्रीय विद्यालय schools हैं या फिर central government के अंदर कुछ public sector units, सारे इन सब के लिए this would be applicable, this particular scheme, that is provision of health facilities in public hospitals, in private hospitals, and wherever there is possibility. Now, when we talk about Ayushman Bharat Health Account ID, that is ABHA ID, this is for the प्रधान मंत्री द जन आरोग्य योजना आयुष्मान भारत, दैट इज PMJAY का जो स्कीम है उसमें जो फ्री टर्शियरी केयर मिलती है ये उनके लिए है. ओके, एक्सक्लूसिवली डिफरेंट, दैट इज फॉर द पुअरर हाउस होल्ड्स. नाउ मेनी टाइम्स इट हैपेंस दैट द कई बार जो ट्रीटमेंट्स होते हैं दैट वुड बी सिमिलर, फॉर विच इन ऑर्डर टू अवॉइड दैट और इन ऑर्डर टू क्लब देम टुगेदर as per the treatments that are provided, the Department of Health and Family Welfare thought that okay, let's link the cghs beneficiary IDs with the ABHA beneficiary IDs so that it would be easy for the implementation, क्योंकि दोनों का objective same है, though the beneficiaries are different but the objective is same, for which this has been done very recently. Now this ABHA ID is nothing but it is a 14-digit unique number that is assigned to individuals for identifying, authenticating and linking their health records across different healthcare systems as well as stakeholders. ये unique ID होता है. Once you register, anyone can register. 50 based on the registration, they'll be providing you with a unique ID, and that will help. कहीं पे भी कोई hospital में गए, with that ID, whatever your health records are there, that would be available in that. Okay, that would help to look into the IDs. Now, before getting into the central government health scheme, कब launch हुआ, कैसे हुआ the eligibility, what is eligibility criteria and what are the features of that particular scheme, let's have a quick look at the ABHA, that is Ayushman Bharat health account, because this is one of the important topics as well. Now, ABHA, it is the digital health revolution, simpler terms, digitization of health accounts. And here it is an integral part of Ayushman Bharat digital mission launched by the Ministry of Health and Family Welfare in September 2021. The implementing body for this ABHA, that is Ayushman Bharat Health Account, is a National Health Authority, which is under the Ministry of Health and Family Welfare. Again, it is a component of Ayushman Bharat Yojana. And why this was in news? Because the National Medical Commission, it has mandated the medical colleges as well to adopt the ABHA ID registration system. अलग से क्यों फिर पेशेंट्स को बोले कि they should go for the registration? Why not do the registration while they come to the hospital for checkups? So this would make their life easy. Now, what is the objective behind this? Now, this particular ABHA IDs it is to create a central repository that would store the medical history of Indians, so that it becomes easy and to track and share the same details with the clinics as well as hospitals. All the details would be stored under this particular health ID number. Thereby, once they enter that ID in the system, whatever the test that they have undergone, whatever the results that they have got, everything would be available. Rather than the person, going through or taking or carrying the reports and all that from doctor to doctor, this would be really very easy. And this will develop a backbone that is necessary to support the integrated digital health infrastructure of our country, thereby helping to bridge the existing gap among the different stakeholders of the healthcare ecosystem through digital highways. Now, this is how they are bridging the gap. So, this is about the Ayushman Bharat Health Account. Moving on to the central government health scheme, कब launch हुआ ये? This was launched in the year 1954 under the purview of the Ministry of Health and Family Welfare to offer healthcare facilities to employees and pensioners both. ऐसा नहीं है कि वो job कर रहे हैं, only then they would be able to avail benefits under this scheme. No, even the pensioners of the central government of India who are registered under the scheme would be able to avail the benefits of this scheme. And this offers both reimbursement and cashless facilities to enrolled members. कई बार ऐसा होता है थर्ड पार्टी प्राइवेट हॉस्पिटल में they would go and get चेकअप कुछ हुआ है, क्योंकि उस सिटी में हो सकता है कि पब्लिक हॉस्पिटल गवर्नमेंट हॉस्पिटल का कुछ उस फैसिलिटी वो वाला ट्रीटमेंट जो चाहिए वो नहीं हो. इन सच केसेस yes, they can go to a registered जो प्राइवेट हॉस्पिटल्स लिस्ट में होते हैं ना, इनके वहाँ पे जा सकते हैं. In that case, they have to first spend the money, then they can get the reimbursements. और बाकी गवर्नमेंट हॉस्पिटल्स and all that, it would be completely cashless facilities to these enrolled members. Now, who are eligible under this scheme? This is provided by the central government to its employees, pensioners and their dependents as well. Okay, and all the central government employees paid from the central civil estimates, जो खर्चे होते हैं for the जो भी central government के employees होते हैं, for them whatever the expenses that are incurred, like your salaries, pensions and all that, they all fall under the central civil estimates. Okay, that is expenses that are incurred, except railways and Delhi administration. For all these, including their families, are eligible for cghs. Now, when it comes to pensioners of the central government, except pensioners belonging to railways and the armed forces, because they have again separately. So, and their families will also be eligible for this central government health scheme, under which whatever the treatments that are available, they can avail them under free of cost. Now, what are the main features? Now, this cghs facilities is currently available. It all started with 14 or 15 cities, and now ये latest data है 2024 का data है. From that we can see that it is available currently in 80 cities in India. And very recently they have revised the rates for general surgery, and this is recently done, effective from 1st February 2024. Now, all these changes are applicable to all these cghs cities and the hospitals that are empaneled, that is, which are on the list. Now, to avail these cghs services, a central government employee needs to submit the forms in the prescribed format. They already have a format enclosing photos of the eligible family members and submit them to the ministry, department or office wherever he or she is employed. ऐसा नहीं है कि कोई central वाला कुछ है, there they have to submit. No, in whatever office they are working, there only they'll submit the documents, everything that are required for them to undergo a particular treatment. Thereby from there they'll get the approval, and based on which they can go to the hospital and get the treatment done. And the current consultation fee rates under cghs is for outpatient department or inpatient, the maximum amount that they can avail is 350 rupees, and the ICU charges up to 5,400 per day. And other features include, see, it's not that allopathy या फिर उसी hospitals में होगा, no. Medications from Ayurveda, homeopathy, Unani and Siddha Ayush systems all are dispensed as well under this particular program. Outpatient care provided at wellness centers, जो आयुष्मान भारत के wellness centers है there, including medication dispensation, that is a free medication. Both outpatient and inpatient services are offered at the government and affiliated hospitals. कई बार ऐसा होता है कि as I said, third party private hospitals are also empaneled. There generally, in majority of the cases, it would be reimbursements. Otherwise, in few cases, it can be cashless as well. With cashless treatment options for pensioners and eligible beneficiaries at the designated hospitals as well as the diagnostic centers. कई बार कुछ बोलते हैं कि this test you have to undergo that test and all that. In that case also, all that would be either in the cashless form wherever it is available, or they can go for reimbursement forms as well. Specialist consultations are available at polyclinics, government hospitals and CGHS affiliated hospitals with a referral from the CGHS as per the, as I said, approval and all that. Expenses for treatment in emergencies at government or private hospitals are reimbursed. कई बार ऐसा होता है कि emergency होती है, so they have to go immediately rather than waiting for the CGHS का कौन सा hospital empaneled है and all that. In that cases also they can get the whatever the expenses that they have incurred reimbursed. Reimbursement is also available for hearing aids, artificial limbs and appliances upon approval. Services encompasses maternity care, child health, family planning, medical consultation, or right from the birth, pregnancy till their aging. For all the facilities are available under the central government health scheme. So, quick recap of what we have done. See, we have seen what exactly is the CGHS scheme. We have seen when and when it was launched. We have seen its objectives. We have seen why, under what context are we doing this scheme today in the class. That also context we have seen. We have seen the latest current affairs associated with this central government health scheme as well. Okay. Now, कल हमने जो 3 social security schemes है वो देखा है, the most important ones which were in the news again and again. आज हम लोग देख रहे हैं central government health scheme. Tomorrow we'll wind this up with the PMJAY scheme. Again, as I said, starting में हमने देखा है CGHS, it is exclusively for the central government employees, and that PMJAY, it is exclusively for the poorer people. Though objectives for both, the majority of the objectives, they are similar, but the beneficiaries or they are different in this case. Okay. Now, बहुत छोटा सा है, ज़्यादा कुछ नहीं है इसमें. I didn't want to stretch this. जो major important points है, all that we have covered here. Now, moving on to the answers for the homework questions from yesterday. Which is the administering ministry or agency for Pradhan Mantri Jeevan Jyoti Bima Yojana? The implementing ministry is the Ministry of Finance, that is the Department of Financial Services. It is administered by LIC or any other life insurance company that is willing to offer the product, this particular product, in partnership with banks or post office. Why that is important? Because it is under auto debit condition. ऐसा नहीं है कि beneficiary को every month pay करना पड़ेगा या फिर every quarter, whatever that he has opted for. No, everything would be debited, auto debited from their accounts. That's why it is mandatory for the beneficiaries to have an account in a bank or a post office. PMSBY is an accident. Suraksha Bima Yojana. It is an accidental insurance scheme renewable every 1 year. So every year they have to get this renewed for getting covered for death or disability due to accident. Now, today's homework questions from the content, that is central government health scheme that we have done. In an office memorandum dated March 28, 2024, the Department of Health and Family Welfare of the Ministry of Health and Family Welfare linking cghs beneficiary ID with ABHA ID. Now you have to tell me this ABHA ID is of how many digits, unique ID, and this they have said that it would be mandatory from 1st April 2024. CGHS is not applicable for the pensioners of the central government employees. Now you have to tell me whether it's a true statement or a false statement. I have given you the statement. You have to answer me with whether it's true statement or a false statement. So this is all from my end. Yes, thank you very much for being so patient. Yes, now the forum is open for your queries, questions, suggestions, any advice or any comment that you want to make, all are welcome. I know it's one of the shortest schemes क्योंकि इसमें ज़्यादा कुछ है नहीं, the list of the treatments, उसमें से कुछ questions पूछने के chances नहीं, because there are hundreds of treatments that one can undergo. There are codes, and for each code they have mentioned what is the treatment that can be availed, and what is the upper cap, that is charges. Okay. So generally those kind of questions wouldn't be asked. Since it is in current affairs, there might be a chance कि ये applicable किसके लिए होगा, और when it was launched, what was the objective or something of that sort. Various features तो हमने already cover कर लिया है, and how the persons can avail this scheme, central government employees, how they can avail, that also we have seen here. Yes. Okay, since I'm not getting any queries, I'm winding up this session. You all know where you can reach out to me if you have any queries through the app also. You can leave a comment. I'll answer your queries there, or in the group as well. Not WhatsApp group, but the Telegram group. Thank you very much once again. Have a great day ahead. Please take good care of yourself. See you all tomorrow at same time at 4 p.m. We'll have a next important scheme that has been in news again and again and would be important for all your upcoming examinations. Thank you once again. Bye-bye.